Hello, I am Dr. Priyamvada Shah. I am a senior obstetrician and gynecologist. My special area of interests are high-risk pregnancy, infertility and laparoscopic surgery. I am currently practicing at Cloudnine Hospital, Pimple, Saudagar, Pune. Let's discuss an important topic today. What are uterine fibroids and what are uterine polyps? Now, the incidence of uterine fibroid is increasing and so as the uterine polyps. Common presentation or overlapping presentation for both these things is menstrual problems. So, there could be excessive PV bleeding during the periods, passage of clots, or the period may last for a longer time. However, the etiology of both these conditions is little bit different. Now, the fibroids arise from the middle layer of the uterus, which is connective tissue, and it is non-malignant tumour. So, fibroids are very common and they may present with lot of bleeding during periods, which is called as menorrhagia, or lot of cramping during periods, which is called as dysmenorrhea. These fibroids can grow to large extent as big as 10-15 cm without having any symptoms and may cause pressure symptoms, so can present with acute retention of urine or frequency of urination or bowel symptoms like constipation or difficulty in the passage of the motion. As against this, polyps are not that notorious in the sense they don't grow big. They arise from the inner layer of the uterus, which is called as endometrium, and often are diagnosed during transvaginal ultrasound accidentally. However, these polyps can present with certain symptoms like intermenstrual bleeding, that is, bleeding in between the two period cycles, or spotting on and off, or spotting after periods, and can present as postmenopausal bleeding or postmenopausal spotting. Now, how do we diagnose these polyps or fibroid? A gold standard test is ultrasound or sonography. Transvaginal ultrasound and a good 3-dimensional TVS can definitely diagnose the polyp. These polyps are really small polyps and can be missed on the 2D ultrasound. Also, MRI can be advised for certain fibroids to diagnose whether they are non-malignant or malignant, especially rapidly growing fibroids. Now, let's come back to the treatment part of this fibroids and the polyp. So, for polyp, if they are not causing any trouble and are accidentally diagnosed, we may not do anything. We just observe that the polyp is not increasing in the size. If you are taking certain treatment for the fertility, then we might opt to remove the polyp. But other cases where there is bleeding problem, spotting problem, we take out the polyp by doing hysteroscopy. So, it is hysteroscopically removed. Same is true for the fibroids. Smaller fibroids, which are 2-3 cm, not causing any symptoms, they remain untouched. We just observe them every 6 months to assess whether they are growing or they are not growing. But if the fibroids are symptomatic, like there are menstrual complaints, or it is distorting the uterine cavity and you are going ahead with the pregnancy, we do opt for the surgery. Also, bigger fibroids or growing fibroids have to be removed surgically. In surgery, there are two options. One is myomectomy, where we just remove the fibroid, keeping back the uterus back, and one is total hysterectomy, where we take out the uterus. Obviously, myomectomy remains the surgical treatment of choice for younger girls, where we want to preserve the uterus and the fertility. So, even if the fibroid is diagnosed in your routine transabdominal ultrasound, do visit your gynecologist. They will advise you correctly how to proceed with the treatment.